Historical trauma is defined as a set of events that are perpetrated on a group of people who share a specific identity. And these events are with the intention of genocide or ethnocide. And often it results in the annihilation of traditions, culture, identities, way of life, and quality of life. Now, if we look at the communities that are most impacted by HIV in this country, we see that those communities carry a legacy of historical trauma. Racial and ethnic groups, like African Americans. Since our introduction onto this land that would become known as the United States, we were seen as property, plagued with violence and rape and victimization, our identities, our language, our culture, our traditions stripped from us. As we fought for our rights in the Jim Crow era, we were faced with more violence, more rape, lynchings, mass murders, and this continues in today, the post-Jim Crow era, where we continue to be the victims of violence. Homicide is highest among African American communities. The same is true for our Native and Indigenous brothers and sisters. As the Europeans landed on their land, which they would claim to discover, treaties were broken. Extermination effort. And not only did they try to exterminate the natives, the indigenous brothers and sisters, when that failed, they decided that it was time to kill the Indian and save the man. And children were forced out of their homes. If the parents decided that their children were not allowed to leave and go to these boarding schools where there was mass physical and sexual abuse of children, the parents were incarcerated. Now we see current day high suicide rates in Native children, adolescents. Victimization and violence is highest among Natives more than any other racial group in this country. And there is an epidemic of missing women. And let's not forget the historical trauma that has been doled out on the backs of our LGBTQ brothers and sisters. Pre-Stonewall, isolation, imprisonment, harassment, violence, murder, bans on immigrants who identified as LGBTQ. As the Stonewall era took place, continued violence, murder that went uninvestigated, a slew of social injustices, and then we see all of this in current day with continued violence, hate crimes, erasure from census and research data. And so the experiences of this trauma we carry with us. We embody it. We hold it personally, and we pass it down over generations. For many of us, we don't know a life without trauma. We were born into trauma. And this results in high stress vulnerability, impairing our ability to cope effectively. And don't flip the script. I'm not saying that this puts us at greater risk for mental health disorders. We have potentially higher stress vulnerability. So what does that mean? That means that we, in the face of continued stress, may have difficulty coping with it effectively. And there is a wealth of data that shows that maternal stress, nutritional and psychological stress experienced by a mother who is pregnant is passed down to her children, and you see changes in infants at the cellular level. And this experience of psychological and nutritional stress during pregnancy results in predispositions for diabetes and other negative outcomes, higher stress vulnerability for their offspring. And there is no doubt in my mind, I've been doing this for many years, that the experiences of discrimination, trauma, and stress are at the forefront of the health disparities that we see today. And what is critical to understand about trauma is that not only does it impact the individual and result in physiological and psychological symptomology, it also impacts the family unit. And it impacts the entire community. So we have communities that are carrying the trauma. And so let's just think about what that means for those of us who carry this trauma with us. If we potentially have a higher stress vulnerability, and we live in a society that continues to stress us out with everyday shit, otherwise known as microaggressions. So what are microaggressions? They are, and all of you know this because you have all felt this, probably today even, the chronic and commonplace daily verbal, behavioral, environmental indignities and injustices that we face as people with devalued identities, whether they're intentional or not. That is important, whether they're intentional or not. They communicate to us hostility, derogatory, demeaning, invalidating, or negative messages about who we are, what our worth is, how important we are. And these things create stress. So the more devalued identities you have, whether you're racially, ethnic minority, sexual, gender minority, previously incarcerated, experiencing housing instability, whatever the devalued identity is, it creates more stress. And why is stress important? Stress is important because it impacts our sympathetic nervous system. Now, the sympathetic nervous system, if it's operating, when we need it, on occasion, is actually a good thing. It's our fight or flight mechanism. So if we need to respond in an emergency, our sympathetic nervous system turns on. And blood is rushed to our heart and our respiratory system, to our gross motors, and it's slowed down in the organs where we need it least, like the gastrointestinal system. So think about what happens then if you are chronically stressed and your sympathetic nervous system is chronically activated and you have this ongoing activation of your sympathetic nervous system. Well, this is one example of what happens to the cardiovascular system. And this happens in all of the systems in our body and is no doubt implicated in the disparities that we see in cardiovascular disease, in diabetes, and you name it. And what is even more important for those of us in the room is that there is absolutely no doubt that stress, stigma, discrimination, experiences of trauma impact every single step along the HIV care continuum. It impacts whether you get tested, it impacts whether or not you show up for care, it impacts whether or not you stay in care, whether or not you take your ARTs and you adhere to that ART regimen, and then whether or not you're virally suppressed along the entire continuum. So it is critically important that whatever we do, whatever interventions we implement going forward for communities with devalued identities, that stress and trauma, discrimination and hate are at the forefront of whatever interventions we do.